turn off my sign to remind me. Welcome, everybody. My name's Dr. Jackie Jacob. I'm with the University of Kentucky, one of two poultry specialists here. The other is Dr. Tony Pescatori. We've been doing these webinars. This is the third one in our series. The other two have been recorded and are available online. This one is being recorded and will also be available online. During the webinar, I ask that you keep your microphones muted. If you have a question, you can type it in the chat box. I will be monitoring the chat box. If the question is pertinent to what Dr. Pescatori will be talking about at the time, I will turn my video back on and ask him the question. Otherwise, we'll hold it to the end. So Tony's going to be talking today, and it's going to be discussing disease prevention. All yours, Tony.
All right, thank you. Let me share my screen.
Yeah.
Share.
There you are. Yeah.
Yeah.
You're up. Yep.
Okay. All right, today we're going to talk a little bit about disease prevention and not working. Hold on a minute.
What's the matter?
My clicker's not working. Hold on. Okay. There we go. So the way we're going to handle this is we're going to talk about prevention. That's the most important thing we can do, is prevent disease as it's occurring in the flocks. We also are going to have some activities about or views of some of the diseases we deal with in backyard flocks. And then whatever kind of treatments that we're dealing with, we'll talk about that as well. So when you think about the chicken, it's no different than any other body. It's got protective mechanisms to prevent the invasion of organisms. The intact skin acts as a direct barrier from organisms entering the bird. The mucous membranes are a direct barrier, and the secretion of mucus tends to dilute and wash out invading organisms. So our open tracts to the outside, our respiratory tract, our digestive tract, are all mucus bound so that they help keep out a physical disease. Along with that, in our respiratory tract, we have cilia, which are hair-like projections from the cells of that tissue that act in almost like a wave or a tide, moving foreign objects out of the respiratory tract. And that's one of the reasons when we talk about things like high ammonia levels in a poultry house, the area that gets hurt or damaged the most is these cilias. So when we have high ammonia, that removes one of the body's defenses against disease. And then also the bird has an immune system, and that takes care of organisms that get past all these barriers. So if we have an intact immune system, they may be able to overcome a disease. One of the key things that we have about disease prevention is biosecurity. Biosecurity is preventing a disease from entering a flock. It's having a secure flock that keeps out biological threats. So biosecurity is what we all should be practicing in our flocks. When we look at disease prevention, there's all kinds of different things that we can do. And also, we don't have to do all of them, but anytime we don't do one, we open ourselves to a threat. So if you're looking at disease prevention, the first thing is find a reliable source for chicks, eggs, and parent stock. A reliable source is one that has a good health program in place, that produces good quality product, that when you buy it, you don't have to worry about bringing in a disease organism. And one of the ways you can say whether or not it's a reliable source is by looking to see if their NPIP is certified. NPIP stands for National Poultry Improvement Plan. And if you buy from those sources, you know they're reliable. So we have day-old chicks or hatching eggs that come in there. The safest way to add birds or any type of poultry to your flock is to do it with day-old chicks or hatching eggs, because they haven't been exposed over a long period of time to potential disease organisms. That's the safest way. Another thing that would help you in disease prevention is separating birds of different ages. Because we have some birds that are young, they are naive in regards to their exposure to disease, while older birds may have built up immunity and may not show signs of a disease, even though they're carrying it. Ultimately, the ideal way to break a disease cycle is all in, all out. You bring all the birds in at the same time and they all go out. That's the ideal way, but for most small flock owners or backyard flock owners, this is not practical because you're maintaining many types of breeds or maintaining birds that are very important to you. Another thing is litter management. The best thing you can do is always have clean, dry litter. So changing out litter when it's wet or when it's moldy is an important way to manage that litter. Another thing that happens is don't mix species. Anytime you do that, you cause a problem. And the two species we worry about is really turkeys and some of the game birds and chickens. By mixing them together, the chickens are pretty much immune to a disease called blackhead, while the turkeys, pheasants, peafowl are more susceptible to it. And the chicken acts as a reserve for that organism and could cause a problem. So when you hear somebody say, never raise turkeys and chickens together, the disease they're talking about is blackhead. If you're breeding flock, if you have a breeding flock and you're breeding birds for your own flock or to sell, it's always a good idea to isolate those breeder birds away from the other birds. Because the breeder flocks are there for a longer period of time, they also are producing chicks out of it. Anytime we can isolate the breeder flock from any other birds, that's a good practice. Another important thing with disease prevention is making sure they have a good feed source, a good quality feed where the birds are in good body condition and are at good nutrient status will really help you keep disease out. Another one is potable water. The quality of the water that we give the birds can also influence their ability to ward off diseases. And stagnant water sources can be a source of disease. One of the things that people always ask about is vaccination programs. We really push is a precision vaccination program, something that's precise. Only vaccinate for diseases that are a problem. Try to get away from vaccination if you can. And then the number one source of diseases is people. And if you want to prevent diseases in your flock, the limitation of visitors and limit of traffic is very important. And I know a lot of times people are very proud of their birds and they like lots of people seeing them. But at the same time, no one should be in the pens unless they're wearing clean footwear. Another thing that a key point, a disease problem to deal with disease prevention is if a disease occurs, deal with it quickly. Most times when you see a disease situation, that may be an infectious disease, and the sooner you can deal with it, the better off you are from reducing the chance of that disease spreading. And we need to properly dispose of dead birds. That's our topic for 2 weeks from now. But making sure that we get the dead birds up quickly and that we dispose of them in a proper manner helps prevent diseases, because that bird dies from something and it may be an infectious disease. The other thing is we need to maintain good records. We need to make sure we know how much feed we're giving, how many eggs are we getting, what are the growth rates. You can't tell if something's wrong if you don't know what your normal production is. So how much feed are you giving? You can, are they eating enough? Is there always a good telltale sign of whether they're healthy or not? What's on your premise is your birds, and that's what it should be. No other bird should be on the premise or of that. And if you do have employees, do they have private flocks? Do they have exposure to other birds? You should know that. And if you're hatching eggs or you're hatching eggs in an incubator, how you properly run those incubators, cleaning up after every hatch, and having good sanitation of the hatching eggs and the operation of hatcher will also prevent disease. And then the management of your farm. Is your feed stored properly? Is the area around your pens well mowed to prevent rodents? Is things properly cleaned? Do you have a good plan for moving from young birds to old birds, or do you have designated clothing for the houses? And then the house itself. As I just said a little while ago, a buildup of ammonia will make the bird susceptible to respiratory diseases because that ammonia can destroy the cilia, which is a key barrier to the organisms entering the respiratory tract. And then the other ones is free flying birds. How do you control those, or how do you make sure that you're not making an area that's conducive to free flying birds? Because they can bring in disease, and particularly they can bring in external parasites. And then rodents and insects are a major concern as well. Rodents are very infamous for bringing in things like salmonella, and insects can harbor disease organisms or may actually play a part in the intermediate roles of some disease organisms. So all those things we just talked about are things that we can do in order to prevent diseases in our small flock, and things we need to pay attention to. And as we go forward, we'll talk about some of these as it relates to actual diseases. One of the key ones is the providing good drinking water, a potable water source that is clean, and we want a source that in the summertime is a cool source of water as well. What we don't want is to have stagnant water, or we want to have water that's been caught in some type of container that the birds have access to, where they might have algae growth or bacterial growth. What we want is a way of watering the birds and at the same time giving them enough water, but also preventing spillage. The two of the items that we have are what we call nipple drinkers. If you notice, the drinking system is above the bird's head. They're reaching up and they're getting a mouthful of water. That's the natural drinking posture for a bird, because the chicken has a hard palate. It cannot sip. So what it does is it picks its head up and lets the water run to the back of its mouth. The nipple water will have a more natural drinking position. The also with the nipple waters, there's less leakage because it is a closed system where the birds do not have the chance to spill lots of water. On the other side, with the white and red drinker, you see it's an open system. The birds can bang into that, they can spill water, but they also, on this one, you have the birds drinking posture where it's even with the back of their head. And if you watch the birds drink, they'll take a mouthful of water and flip their head back, just like they were drinking out of the nipple. So either any of these are better than a stagnant water source, but some are different than others. Get a water source that you are comfortable with and make sure that even in the summertime, that you provide a cool source of water. Another thing that we can do for the hens to help them fight off disease is make sure they get a good quality feed, a balanced diet that has a good quality feed. Because good nutrition is important for your bird as it is for you. So if you're sitting there and you make sure that they get the right feed for the right species at the right age, you're going to be able to have that bird in a good nutritional status. And that gives them the chance to fight off disease if they're challenged. While we're on the subject of feed, one of the diseases we see a lot of this year, and any year where we have a wet spring and a wet fall, is a disease called mycotoxin. Mycotoxin is a mold that can occur on corn, and the fungus puts out toxins. There's 37 or more, hundreds of different toxins, but there's 37 different toxins we worry about in poultry. But moldy feed is a source of those mycotoxins. Crusted feed in the feeders. If you have outdoor feeders or you have feeders where the birds have the water nearby, if you look in the corners, if there may be crusted feed or moldy feed in those feeders. So it's always a good idea to clean out your feeders periodically. If the feed gets wet, it can mold as well. It's the toxin that the mold produces that causes the problem. Sorry. So some of the symptoms that you see is, one, you see you can see with one of the toxins a lesion inside the mouth. This is a toxin called T2 toxin. We see it a lot of times in laying hens because they're eating out of feeder and it gets on their their mouth. One of the things that we see an awful lot of, if the feed is moldy to a high level, you can see paralysis. The birds will have a paralysis in their legs. They can have paralysis in their wings. They cannot walk. They may even walk on their wings. So paralysis is one of those telltale signs in some of the cases where you have mycotoxins. And then you can also have a reduction in feed intake and a reduction in egg production. One of the key points of controlling the mycotoxins is when you get a bag of feed or a new shipment of feed, is to make sure that the feed looks and smells like you normally see feed. I just had a situation this year where the owner of good number of birds had moldy feed delivered or bad feed delivered. And he knew when he opened the bag, it didn't look right. And he even saw some calf pellets in there, but he still fed the feed. So that's one of those things. If you do see feed that you think there's a question about, talk to your feed dealer about it and say, is this correct? But it is a problem that we do see. The nice thing about the mycotoxin in regard to paralysis and some of the other conditions, if you pull away the toxin or you pull away the moldy feed, the birds will recover and eventually even begin to utilize their limbs. So all these things we talked about on prevention, sometimes it doesn't stop a disease. So one of the problems we have is we need for people to be able to identify things that are indicators of disease. Some are very obvious, others are not. If you're experiencing sudden death, that's a sign of a disease. Whenever you see a dead bird or a group of dead birds, you need to ask yourself, what may have caused that? An important one that occurs probably faster than anything else is a reduction in feed consumption. And that's why we need good records. How much feed are you giving out, and how much are the birds eating? You know, I don't care if you measure it in bags of feed per week or scoops per week, but I do need you to think about how many am I normally feeding these birds? And if feed consumption is suddenly reduced, you might have a disease problem. The manure itself may be a problem. Normal manure is well formed. It has the uric acid on it, and it's not runny or have any blood in it. So what is, and the other thing is, if you have birds that are penned up or in cages, always look at the bottom where the manure goes. A bird that is not eating is not going to be producing manure. Another thing is respiratory signs. Because the bird is the way it is, it doesn't do a lot. It doesn't have ability to use its diaphragm to move anything out of its respiratory sign. So you will hear things like sneezing and gasping for air. You may see nasal discharges, or you may see a cough, but that cough is a little different than ours. Our coughs are big and powerful. Their coughs are not nearly as powerful. Another thing that we get a lot of calls on is when you start seeing tissue around the eyes or the neck area where you start seeing swelling. And a lot of times when or the eye itself is swollen. And a lot of times people think that's an eye infection or related to that. When in fact, that is where the bird's sinuses are. So a lot of the respiratory diseases will manifest itself as a swollen face, so that they start seeing that swelling as in the one bird, or that puffiness around the other bird. So that is a sign that you may have a respiratory disease. And it's for a couple of the bacterial respiratory diseases, this is a very telltale symptom. So it's not an eye infection, but at the same time, you need to know that the nasal passages, the mouth, and the eye are all connected together. And so when you get a disease in the respiratory tract, it can be manifested in any of those locations. And then another design of disease is a bird with reduced bird activity. One of the things they call is listless. If you look at those birds, you can tell that they're just not feeling good. Kind of looks like us when we have a stomach bug or the flu. They're just not feeling good. They have reduced activity. You know, that is a sign that you have a disease problem. And then another one that occurs an awful lot and similar to this is neurological disorders. You might have tremors, you might have droopy wings, you might have a twisting of the head and neck, you might have incoordination, or you might have complete paralysis. All those things are symptoms that you have a disease in the birds, and how to pinpoint what the problem is. It can be in regards to paralysis, it can be the mycotoxins, it could be a nutritional deficiency, it could be a virus, or it could be even a bacteria. So those are the things that when we start talking about a disease, that we talk about what some of the symptoms or signs of the disease. So I always say is know what normal looks like so you can tell me what abnormal is. So how do we prevent all these different diseases from occurring? Well, there's some certain things we can do. One of them is having a good, high quality, disease-free bird, whether it's young chicks and eggs or adults. If you're buying chicks or eggs, purchase from an NPIP flock. That is part of the National Poultry Improvement Plan. And I'll go a little into that. But if you're adding adult birds or older birds, a key way to prevent disease is quarantining new birds. When you introduce new birds to your flock, quarantine them. I like to see them quarantined for at least 30 days. And when we talk about quarantine, is put them in a separate area and also manage those birds as the last birds you go to, and have designated footwear or even designated clothing that you wear around them. Once they don't show any signs of disease over that 30 days, then you can slowly introduce them back into your flock. This goes through buying new birds, or it also pertains to if you're showing birds or bringing birds to any location that you are, when you bring those birds back to the farm, or your flock, make sure you quarantine them. And the National Poultry Improvement Plan has a bunch of diseases that it covers. Most of the diseases are what we call egg-transmitted diseases. They're diseases where the female, the hen, can be a carrier of the disease, and it can pass through the egg to the offspring. Everyone on that list is an egg-transmitted disease except one, avian influenza. Avian influenza is a virus. It's transmitted not by the egg, but it is in the program. The other ones are the salmonellas and the mycoplasmas. Those are diseases that are transferred. Okay? MG and MS are two of the diseases that all birds can get, while MM is a disease specific to turkeys. It's a voluntary state and federal cooperative system where the breeders are tested and they are certified to be free of certain diseases. At the same time, they also certify that the hatchery is managed properly, has good sanitation, and only deals in NPIP stock. And that certification program is we're going to certify the breeder flocks. We make sure that the baby chicks are healthy that come out of the breeder flocks, and the poults are covered. The hatching eggs are covered. There's the hatcheries and dealers are also covered in the program. And if for interest, the first meeting of the National Poultry Improvement Plan occurred in 1932 in Louisville at the Brown Hotel, which is still there. In there, the industry got together, all the poultry breeders, and they had a disease called bacillary white diarrhea. It was what was now we call Salmonella pylori. At that time, it was killing 60% of the chicks that were hatched. So they went and certified the breeding stock because carrier hens showed no symptoms of the disease and were producing diseased chicks. We still to this day test our breeder flocks for Salmonella pylori. So if you show birds when you go to the state fair or to a poultry show, one of the things they ask you is that you are PT clean or have been tested for PT. That's Salmonella pylori and typhoid. Those are two salmonellas that we still to this day have been testing for. Salmonella pylori is an egg-transmitted disease. It's the female, the adults can be have no symptoms. They're carriers, and every flock that is enrolled in NPIP is tested for Salmonella pylori. So those birds have to be tested prior to going into egg production for hatching eggs. So all those are, and most states have a surveillance program through their shows, and anytime we have a commingled event where they have to prove testing for Salmonella pylori. Along with it, we have Fowl typhoid, which is Salmonella gallinarum. It too is egg transmitted, and it's an example of why we really worry about humans, wild birds, and rats, or mice, is because it's easily transmitted and spread by those type of vectors. The mycoplasmas are one that not a lot of flocks test for at the backyard level, but most of the commercial poultry operations do. The mycoplasmas are very common in backyard poultry. In chickens, Mycoplasma gallisepticum and Mycoplasma synovi are very common if you have a disease outbreak. And there are mycoplasma, which is a type of bacteria. And most of the time, the mycoplasmas will show you respiratory symptoms. The mycoplasmas are vertically transmitted, meaning they're transmitted through the egg from the hen to the chick or to the poult. And they can also be spread by aerosol, so they can breathe it in, and it can be carried by vectors such as inanimate objects and things of that nature. The bird has a unique respiratory system. It has fixed lungs. It has structures called air sacs, and their skeleton has pneumatic bones that are connected to the air cell, to the respiratory tract. Because of that, once we get a disease in the respiratory tract, it has access to the entire body cavity of the bird through the air sacs. And one of the symptoms of mycoplasma is an infection of the air sacs. You have a clouding of a clear membrane. That clear membrane is the air sac. You might have clouding of it. MG is a swollen face. Remember, it's going to be a respiratory disease. It's in the sinuses. Most times when we see swollen eyes, it's probably a Mycoplasma gallisepticum. They'll have discharge from the eyes, and the birds will have a snick or cough. When we talk about MS, they actually have swollen joints and swollen foot pads. How do we keep this one out? We keep this one out by isolating our flocks and making sure that we keep a clean area. The good thing about the mycoplasmas, they're very susceptible to antibiotics. So there are antibiotics such as Tylan that can be used against the mycoplasmas. One you hear a lot of disease you hear a lot about is avian influenza. Avian influenza, there's two forms that we worry about. We have a low pathogenic AI and a high pathogenic. So we have low versus high. With the high, you can have high mortality, you have hemorrhages, and it looks a lot like Newcastle disease. Here's a picture of a bird with high path AI. And that influenza virus has little knobs on it, and we classify it by those, the N and the H that's on the side of the bird, of the organism. There are 16 H's and 9 N's, and the highly pathogenic AIs are H5 and H7. Low path are usually the 13 other A's. Within the MPIP program, we have testing programs to monitor H5 and H7. It's severe, the high path is as a severe disease, high mortality, while the low path is a mild disease and low mortality, and many of the other ones are there. The reason I bring this one up is this is one of the diseases that if it occurs, we need to do a lot of different things in the state. We will quarantine facilities. We will also have testing programs within a zone of infection. And this is where small flocks come in, is even if a commercial flock has it, they'll draw a circle around it of 6 meters, 6 meters or kilometers, and they will then test all the birds within that area. This is a highly reported disease, and we're very concerned about it. In the poultry industry, the commercial industry, they screen all flocks that go for sale for AI. So all the broilers that are produced when they go to the processing plant before they leave for the processing plant, they're screened for AI. All the layers and the breeders that are sold after being in lay are screened for it. So we have a very big surveillance program for this. And the reason we have outbreaks is there is a reservoir of avian influenza virus out there in nature. If we have a vector, some way of bringing that into susceptible population of poultry, you will have an outbreak. And one of the reservoirs is migratory birds. This is an example of the migratory patterns of the world. And if you look at all the different colors and you look how they blend together, we have a lot of the different migratory birds during the summer that will vacation together in the north. And then they disperse from there. So we have a lot of interaction of those migratory birds. So there is the potential of spreading disease from one part of the world to another. In the United States, we have 4 main flyways. We have the Atlantic flyway, we have the Mississippi flyway, here where Kentucky is, and we have the central and then the Pacific. All those flyways have birds that move through it in the spring and in the summer. And the way that we can, an affected bird, we can spread this disease by people, by vehicles, by aerosol, by rodents, by insects, by wind, wild birds, by a fecal oral route, or by infected birds themselves. This is a type of disease where we do surveillance of all types of poultry, and we also make sure that if AI is detected, there is a response plan in place, because this is a very serious disease. The last outbreaks occurred probably in 2017 in our area, and there was some outbreaks in 2019 in other parts of the state, of the United States. Besides avian influenza, which is a viral disease, there are other viral diseases that we worry about. This one I just put up because you really don't see it a lot in many cases in small flocks, but it is a disease that we have in the poultry industry vaccinates for it. The small flock people do not, but it's an immune suppressant disease. It's a disease that destroys the immune system. A lot of times that makes the birds more susceptible to other diseases such as infectious bronchitis. I only put this up there is to let you know that there are some agents that are immune suppression in birds, and this particular one can be transferred by mosquitoes. All right. And another thing that can transfer it is the Darkling Beetle. These are the hard beetles that may be in your litter. As I said, we have that respiratory system that we have, and it has all those parts there. And so the respiratory diseases are very important. One we can have is sometimes we get respiratories just very much like we get a common cold. There's some viruses out there we've not identified that causes the problem. Anytime we have a transition, such as spring and fall, well, you can have some respiratory disease. You can have all those sounds, and the birds still continue to eat and drink. They're still active. So non-specific respiratory disease do occur, but that doesn't mean you have to worry about them. A Laryngotracheitis is a very deadly, very high mortality. The birds actually will, when cough up blood when they cough, and you might see blood on their feathers, their mouths, or their beaks. But it's a respiratory disease. We have pockets of it throughout the country, but most cases the states don't vaccinate for this one as well. One we might see in backyard flocks is infectious bronchitis. This is a respiratory disease that also affects the egg production or the production of the bird. You'll see a drop in egg production. You'll start seeing poor eggshells, poor quality eggs, as well as respiratory. This is also true with exotic Newcastle disease. But you start seeing the eggs being misshaped, and a telltale one that you have one of these two virus diseases is that the albumin of the egg, there's no longer any thick albumin. You have runny albumin in the egg of freshly laid eggs. Bronchitis is one that we spend a lot of time. This is one that can be brought in by birds they may be immune to it, especially with exotic Newcastle as well. They may be immune to disease, but still harbor the disease. So when you bring in birds, they may bring that disease in onto your farm. Valpox is an old disease that we have. There's two forms. There's a wet form and a dry form. The lesions on the membranes in the wet form, it'll be in the respiratory tract and the mouth. The dry form is the kind that we usually see. It has lesions or scabs on the unfeathered parts of the skin, the comb and wattles. Okay, blister scabs. You get if you do have Valpox, they will build up immunity eventually, but it's also a very ancient disease. So if your farm has Valpox on it, you will have Valpox for a very long time. One of the things that you can do is you can open the blisters and take off the scabs and treat with an antibiotic ointment and keep out a secondary infection and try to control it that way. But the virus is still going to be there. With the wet form, you may see mortality because the lesions in the mouth may block the bird's passage for air as well as its ability to eat. Okay? Prevention of Valpox is biosecurity. If you do have a problem, this is a disease that you can vaccinate for. It's an individual bird vaccination, and it's done with the older birds. And this vaccine is actually done with a special tool called the wing-webbed vaccination method. And anytime controlling biting insects like flies and mosquitoes are also very important. So getting rid of stagnant water and controlling mosquitoes is important. Another viral disease that we see is Merrick's disease. This is a viral disease. It usually occurs in birds less than 6 months of age. It can cause a paralysis of the legs, wings, and neck. It also can cause bumps on the skin. These are as a tumor-producing disease. It'll cause a tumor in some of the nerves. That's what causes the paralysis. It causes tumors on the skin. And it also causes a telltale condition called gray eye, where you have gray iris and a misshaped pupil. This is a disease that we highly recommend when you buy birds from a hatchery that they're vaccinated for Merrick's disease. We usually do this a day old, and it's one of the things, or even before that, the way we have it in commercial industry. But we recommend that this is the one disease that's very ubiquitous throughout everywhere, and we recommend that is vaccinated. And then we have different bacteria. We have the swollen face again with fowl cholera, swollen joints, twisted neck, all those symptoms that say it's a respiratory disease. Fowl coryza is another one, the same type of syndromes. If you're looking at it, you can see these birds, when they have a respiratory infection, it's occurring in the face area because it's in the sinuses. The one big characteristic of fowl coryza is that the discharge has a very pungent odor. It stinks. Okay. Both those diseases, along with the mycoplasmas, can be treated with antibiotics in the drinking water or even ocular if you only have a few birds. So those are some of the things you can do with that. But isolation, again, is what prevents this. And then there's also a bacteria that causes botulism. Botulism occurs more than you think. We've seen it many times when their birds have access to decaying materials. I've seen it in years where we had severe droughts and the farm ponds were recessing or receding because they didn't have any replenishment of rain. And the vegetation along the edge starts rotting. And I've seen birds get botulism from eating that vegetation around the pond. I also seen botulism when people feed table scraps and do not clean up after them. If you're going to provide any type of table scraps, make sure it's in a controlled container and that you clean up any unused food, because that can rot and that causes the botulism organism to flourish. And the thing that gets the bird is not the organism, it is the toxin. And it will cause extreme paralysis, and it also causes a condition called limber neck, where the bird's neck is paralyzed. If you put its head over the table, it'll just flop down. It can't lift up its head. I always wonder about people that take Botox treatments where they actually take this toxin to do some paralysis in their face, when that poor bird wish it didn't have the toxin. And then anytime we overcrowd the birds, we can cause scratches. And those scratches can get infected. And once they're infected, they can have a dermatitis. And things that can cause the infection, cause the birds to scratch each other, is if they're overcrowded on space or you do not have enough feeder space. I always recommend that you provide enough feeder space so all birds can eat at the same time. Birds sometimes will trigger on some type of signal that they want to eat, and they'll all go to the feeders at the same time. The ones that are eating will then have other ones trying to squeeze their way in. They'll scrape their backs or their hips. They'll get infected, and you'll have problems with it. So overcrowding gets you the condition of dermatitis. You want to prevent it by having enough room. All right. Avoiding exterior parasites. External parasites are another problem that a lot of you have experienced, and a lot of you may experience in the future. The external parasites, more than likely, can be spread by wild birds. So some of those birds may have those parasites on there. If you look on here and our website, we have a really good publication on external parasites put out by our entomology department that gives you some input into how to prevent external parasites. All right. It's publication 516. But it's a good publication on external mites and insect parasites in backyard chickens. All right. One of the ways we can prevent external parasites is by providing a dust bathing area. All right. It can be dirt, it can be sand. You can add some diatomaceous earth to the dusting area. You can also add a dusting powder that'll have an insecticide in it. But the birds have a natural instinct to dust bathe. It helps them get rid of external parasites. If you're going to use diatomaceous earth, make sure you buy the feed grade diatomaceous earth. But you having a set area for them to dust bathe in will encourage the behavior and may help you prevent external parasites. Detection of the problem. If you start seeing dirty feathers around the vent area, A lot of times these external parasites go around the vent area to get moisture and to drink. They're slow moving on chickens. Uh, Birds that are infested may go out of egg production. They may act like they're not eating well, so they may lose weight. They may lose that healthy comb color. They may also start pulling feathers on each other. And sometimes you might see some scale of them pulling or irritating their skin. All right. And if you see bugs crawling on the skin or nits on the feathers, those are all signs that you have it. And some of the external parasites that we have lice, we have mites, we have fleas and ticks. We also have red mites, which live in the poultry house and visit the bird. And then we can also talk about darkling beetles, because darkling beetles are a source of disease, and it's an insect. It counts as a parasite. Body lice are small, yellow to brown, cigar-shaped organisms. They're on the bird's skin. And the thing about the poultry lice is there's lots of different species of these. And where they usually infect the bird is what usually gives it its name. So all those different names are associated to where on the bird's body it has the lice. But a telltale thing is the lice cannot live on humans, dogs, or cats. But they once they're on there, they may drop off on you, and it's only a temporary thing. Usually, what you see is a buildup of nits or the lice itself around the vent area. Here's another example of lice eggs being on the bird's vent area. Seems they like that area on the birds. So when you go to check your birds for external parasites, that's the area you're looking at. The northern fowl mite, it lives on the bird full time. So it's a very small mite. You may not see it. But the one that's a real problem is the red mite. It doesn't live on the bird. It lives in the poultry house, in the creaks and crevices of your poultry house. It comes out at night to feed on the birds. So with the red mites, you not only you have to treat the building, not the bird. All right. Northern fowl mites look like this. You'll see them on the egg itself, and you might actually be bothered by them. But again, they're not going to stay on you. Here's another example of northern fowl mites. And again, here's the vent area. You start seeing up a buildup of eggs and insects. The red mites are very small. You need to treat the whole house because they're going to get off the bird and live in the cracks and crevices of the poultry house. Another one that we see an awful lot of is scaly leg mites. In this particular mite, the mite burrows underneath the scales of the shank area and the toes, and it starts reproducing under that scale. It'll increase in number and it'll start bulging the scale. It may actually deform the foot or the leg. Unfortunately, most times when we see the scaly leg mite, it's already too far to be treated successfully. We can stop it. And usually the treatment in this case is to use a petroleum jelly or an oil to cover the shanks. This suffocates the mite. And most times, though, we're a little too late on that. But if you do see this, you need to check all your other birds because it'll move from bird to bird as well. But scaly lice, we usually get some calls on that, but it's usually too late. So it is always a good idea with your birds to look at their scales and make sure you're not seeing anything where it's like bulging out, and treat them as soon as possible. Another thing you can have is fleas, and those fleas are the same fleas that affect your pets and your birds and your rats and your mice. Uh, I when I was in graduate school many years ago, we had a project with pheasants, and we were artificially inseminating the pheasants. When we took a break, I looked over to the other people, and they were doing the same thing I was scratching all under our coveralls because the birds got fleas from the cats that were in the house, and we got fleas from the birds. So it is a problem that can occur. That's why I don't like a lot of times having the cats or dogs running with the chickens. We can also have a stick flea, which is a small insect that affects around their eyes and face, the unfeathered portions, and they'll latch on to that as well. And then another thing that's coming up that you need to be aware of is that bed bugs can occur in chicken houses. Anytime they have the ability to find a crack to hide in, and they have the birds to feast on at night, they will be there. And those are the same bed bugs that can go back into your house. So be on the lookout for those things. And making sure that you keep a well-managed house is important. And then we can also get some of the different ticks that'll attack the birds. And then the other one is the Darkling Beetle. This is the lesser mealworm. It may come in on your feed. It may come in for other reasons. It'll grow, and the Darkling Beetles will live in the insulation in your houses, come out and feed on the feed, and can be a source of disease. It can transmit disease such as Merrick's disease and some of even avian influenza. And it does spread cecal and tapeworms. So all these external parasites can be a threat to you. What we can do is treat with certain products. But when you're dealing with poultry, you must use the products that are approved for poultry. An example is Seven Dust. At one time, Seven Dust was legal to use on poultry. That characteristic of Seven Dust is no longer valid, so you cannot use it for poultry. Another thing is Ivamectin. While it's an effective control of parasites, it is not approved for poultry. But we do have things like the insecticides, like the paramethrins, and we have also the perithrins, which are some of the plant-based preventatives. The pesticides obviously are longer residue life, while the perithrins are short life. None of the products we're listing here we're endorsing, but it gives you some idea that there are products out there. And it comes in different ways. You can have sprays where you can spray the facility with the pesticide. If you're trying to do organic, make sure the product you're using is okay for organics. Make sure it's also labeled for use around poultry. We can also use a dusting where we have perithrins in a dust powder. We can dust onto the birds and control your parasites as well. Another thing you can use is a product called flour of sulfur. This is brimstone. It's an old remedy. It can be used as an ingredient in dust baths. It can also be dusted on the bird, and it can actually also be used in a dust bag that the birds would rub against. So flower sulfur is another way of controlling it. Some of the botanicals, such as the perithrins, come from chrysanthemums. So it is a natural product that can be used to control some of your parasites. We also have some essential oils as well. Here we have a product that uses clove oil as a active ingredient in cottonseed oil as a way of treating and spraying the bird. We also have external controls where you can put out in dust baths. And we also have diatomaceous earth we can put in our dust bath. Not only do we have to worry about external parasites, we have to worry about internal parasites. Most cases, a few worms do not usually cause a problem, but a large number can dramatically affect the growth and egg production and the overall health of birds. And an infestation may make a flock less resistant to disease and can make existing disease conditions worse. In most cases, the parasitic egg is consumed either in contaminated feed, water, or litter, or by eating intermediate hosts, such as snails, earthworms, or other insects, which can carry the eggs. The infestation, what we have found in some research we've done looking at trying to look at worms, is the infestation can be highly variable between individual birds. We've been on farms where we have checked for eggs, parasitic eggs, then posted the birds trying to find a source of bird. And we may find that out of 45 birds on a flock, 8 of them may have worms, but they have a large infestation of them, while other ones have no worms or very low number of worms. One of the things that breaks this cycle of where you have birds consuming is using wire. It causes you have less problems with intestinal parasites because the birds cannot consume their litter or their manure, and they cannot or have access to some of the insects. A lot of the game bird producers will raise their breeders on wire to break that disease cycle. The birds, if they're heavily parasite, will be unthrifty. They'll have poor growth and feed conserve. They'll have a depression in egg production, and they can even die from it. We have large and small worms. In this case, the roundworms, they'll infect the intestine. Here's a heavily infested bird. But the same bird next to it in the same flock may not have any worms. You can have cecal worms. The cecal are the 2 blind pouches off the large intestines. That worm will live in that area. That is the carrier of blackhead disease. We're experiencing a large influx of blackhead disease in turkeys, both commercially and backyard, because most of the products that have been used to control blackhead have been taken off the market because they're carcinogens. So we don't have anything to treat turkeys with. But this is one of those diseases where the cecal worm may not affect chickens, but will affect turkeys in a big way. So it's the disease that we talk about why we don't raise chickens and turkeys together. Birds can have tapeworms. A few tapeworms won't do any damage. A heavy infestation will cause the problem. If you have a heavy infestation, some of those tapeworms may actually migrate down the full length of the digestive tract and will actually go up the reproductive tract, and you can get tapeworms and some other worms in eggs in a heavily infested flock because they go down. The cloaca is a common opening for the digestive tract and the reproductive tract, and those worms may move along. We are very limited on the types of wormers we have. This is one of the types that's there. If you're using some of these, you need to follow the withdrawal numbers. Withdraw 14 days for meat, chickens, and turkeys. This wormer is not approved for laying hens, so there is not a lot of product available for it. Again, there's another, the fenbendazole is a product that can be used. Not all of it has been approved, and it's not approved for laying hens. With wormers, the laying hen is not very many things available for it. And the reason for that is many of these wormers can show up in the yolk as the bird consumes these things. And because of that, it'll deposit in the yolk. All right. So here's a particular poultry wormer that's approved for all birds. The suggested egg withdrawal time on it is 7 to 17 days. Anytime I'm worried about a drug residue in eggs, I usually recommend 30 days. So if you're giving a medication to laying hens, I would not collect eggs for at least 30 days after the last day you give a medicine. And with meat birds, it's usually 1 to 6 days. All right, another product in there. Of course, anytime you're using one of these, read the labels and use it as directed. Here's a particular one. This is not a pesticide. This is a type of product that contains concentrated food grade diatomaceous earth. Not only can you use diatomaceous earth for external parasites, you can use diatomaceous earth, as long as it's food grade, as for consumption with the birds, and it'll have some effect on the worms. And then we have external parasites. Coccidiosis is a major problem in birds. It is a protozoan. There is 9 species that affect chickens. I think there's 5 species that affect turkeys, and they attack specific locations in the digestive tract. These protozoans have a life cycle in the bird as well as outside the bird. This is one of those organisms where the consumption of fecal material spreads the disease from one bird to another. So it is very easy to spread coccidia right through the entire flock. This can be broken up. We've never seen a lot of coccidia in birds that are raised in cages because the droppings drop through the cages and you break the life cycle of the coccidia. Fortunately for coccidiosis, there are ways to prevent it. You can buy medicated feed. Most of the time, the medication is amprolium, which is a coccidiostat. That is a medication that prevents coccidiosis. You can also vaccinate at the hatchery for it, or even actually later. But you can vaccinate at the hatchery. You can request that the birds be vaccinated for coccidiosis. If I was raising a lot of birds for an organic situation, I would, where you want to, or no antibiotic or no drug situation, I would probably vaccinate the birds for coccidiosis as a preventative, because it is a very widespread disease. There is a water treatment. Corrad is amprolium that you put in the waters. And associated with coccidiosis is another disease, is enteritis. It's a clostridium, it's a bacteria, it attacks the digestive tract. And what we see is that it is usually related to coccidiosis, whether it's the fact that the enteritis occurs first and opens the birds up to coccidia, or coccidia occurs first and opens the bird for clostridium. For you that raise cattle and that you're vaccinating the birds, the cows for blackleg, Clostridium perfringens is what you're vaccinating for them for. So it's the same type of organ. It does live in the soil, and there are some antibiotics, such as bacitration, that can be added to the feed to control this organism. But there's some general things that we can do to prevent internal parasites. We can remove all litter and between flocks. We can keep the litter dry as possible, because most of these organisms need some type of moisture. And we need to avoid overcrowding that stresses the bird, keeping wild birds away, and using a coccidiostat in the feed or vaccinating the birds is possible. And we want well-drained ranges or paddocks or runs, so that the ground does dry out. And never put birds on freshly ground or plowed land, because the earthworms will come up and they may harbor disease. And you can use insecticides to control the population. Feather picking and cannibalism, it's an open wound. There are things like no pick that can be used on it. It'll be a color that they can't see and will cover up the wound. To prevent feather picking is to prevent overcrowding, and also to put into the pen enrichments that get their attention, whether it's a shiny, I know some people that hang Coke cans, let them beat up on the Coke cans. There's also some chick pick kind of things, or mineral blocks that you can put in a pen that distracts the birds. Even a bale of alfalfa hay will work with that. Or you can put in you can dress the bird up and have it so that it prevents feather picking. We can also have frostbite. I don't know if anybody experienced that with the winter we had, but they can have frostbite. Wound care is available. A bumblefoot is an infection of the foot pad. If you have a condition like that, it means there's been some type of injury. And my first thing is, one, you can treat the birds with an antibiotic, or treat it with a topical antibiotic, or a other antibiotic. But at the same time, you need to see where the damage occurred. It could be anything like a nail, or it could be extremely rough roofs, slats. All right. There are things that are some antibiotics that are out there. There are some antibiotic ones. You can even use things like the bacitration or neosporin trade creams that you can get in any pharmacy for people. And then we're going to close out. One of the last things is we talk about is what we can feed the birds. So when we're looking at this chart, there are certain things that are dangerous to birds and to really any animal. One of the things that people don't realize is raw potatoes and raw green tomatoes are highly toxic and could cause problems with the bird. So we want to make sure those never get into the things you're feeding the birds. There are things like highly acidic foods can churn the pH of the digestive tract. The pit and the skin of avocados can be dangerous. Dried beans can be dangerous for the birds, or any moldy vegetable that you have can be dangerous. Any of these things that we have on this list or look at are things that you can feed as a treat. They are not things that you want to base your entire diet on, because there are fun treats. There are things like eggs and fish and things like that you can be, or there's even some of the fresh vegetables. Whatever you're using, we want to make sure we clean it up because we don't want botulism. Once in a while, we do see an impacted crop. The crop is an outpocketing of the esophagus or the tract to the digestive tract. It's a pouch that the birds fill with feed when they eat. Sometimes the muscles around that area lose their tone, and it can cause a pendulous crop or an impacted crop. The only thing you can do is massage out the materials, lubricate with vegetable oil, and hope for the best. I've never had any real good luck of improving an impacted crop. And if I want to go back to this one of the things on there is grass clippings. Be very careful when you use grass clippings because you want short pieces of grass. Long pieces of grass can actually get twisted in the bird's crop and gizzard and cause an impaction. And if any of these things are being fed, you probably want to use a grit, which is an insoluble stone that the birds can grind the food with. Pasty vents, this is an example. In this case, it may be highly indigestible feed. If you have a feed that's high in maybe wheat or barley, that's not been that doesn't have any enzymes with it, it may cause the pasty vents. Reproduction, we see blood in the eggs. The blood comes from the fact that when the egg is ovulated, the yolk is ovulated, it's at an area called the stigma. The stigma lacks blood flow, and when it breaks out, that's where it breaks. There's no bleeding. If it breaks anywhere else, you might have some bleeding. Soft shells, more than likely, it's a calcium deficiency. However, some of those diseases like infectious bronchitis and Newcastle disease may give you an increase in soft shells. Here's an example of the runny albumin with the infectious bronchitis. Here's the normal egg on the one side and the runny egg on the left. They're both fresh eggs. And then another condition you might see is internal layers. If you have an internal layer, it's because either the infundibulum or the first part of the oviduct doesn't grab the egg, or you may have an injury to the oviduct and the egg actually comes out of it. One of my closing remarks is veterinarian care. You need to build up a relationship with a veterinarian, that you have to develop a doctor-client relationship in order for you to obtain drugs and medicines. Most of the drugs and medicines that used to be over the counter are now required by prescription, and a veterinarian must have a doctor-client relationship in order to write the prescription. You also need a veterinarian if you're submitting birds to a diagnostic lab. So if you have a veterinarian for other ones, build a relationship with them. I know a lot of them do not like to do birds, but you do need to have them available sometimes. Vaccination, to start out, the things at the hatchery we would like to see vaccinated is Merrick's disease and possibly coccidiosis if you're in a no antibiotic or no drug situation. But on-farm vaccinations for all the other diseases, you need to, it really depends on your farm history. If the disease has never occurred before, you don't need to vaccinate for it. However, if you do have a disease problem that's reoccurring and you want to vaccinate, you have to remember that most of these vaccines for poultry come in large quantity. So you need to be prepared to buy large quantities of vaccine, which means that the price is a little higher and that you have to dispose of the vaccine properly. So just to close out on summarize what's going on when we want to prevent disease, we want to make sure we keep our distance. We want to isolate our birds and have a safe distance from other birds, from people, and from any of the vectors. We want to make sure everything is clean and disinfected. We want clean cages, clean pens. Make sure you're properly disposing of dead birds and making sure that you remove any wet or cake litter. Anytime you come home, whatever items you use to go to a show or went to a swap meet or any of that thing, make sure you're cleaning your vehicles, make sure you're cleaning your cages, and make sure you're cleaning the floorboards of your truck and your pedals. And then don't borrow disease, don't share equipment between farms. If you don't share cages or poultry supplies with your neighbors, if they have a disease, you'll have a disease as well. And then the warning signs, we talked about all those signs of disease. Know what normal is for your birds. Know what their feed consumption is. Know their behaviors, their activities, and that will be able to have early diagnosis or detection and help stop the spread of disease. And if you do see that you have a problem, make sure you contact someone that can help you. And then the other one is try to keep your wild birds and your birds separate because they can be a source. Don't put your feeders and your bird baths that close to your birds. So with that, I'll answer any questions and go from there.
Great job. Great job. You can type your questions in the chat box. I've been answering a few, but some that came up. Thailand, you mentioned, that's under the FFD, right? So
you have to have a prescription for it.
They have to have a prescription for the Thailand, and I was going to ask about that.
And it's not the Thailand injectable that you get for cattle. It's a water-soluble powder that you put in the drinking water. That's what you treat birds with.
Right, but you need a veterinary.
You need a prescription for it nowadays.
Okay, I have a question about the Merrick's disease vaccination. If they get, always buy vaccinated chicks and then hatch out their own chicks, should they be vaccinating their own chicks?
If they have a problem. By vaccinating, you're breaking a disease cycle. So maybe you don't have it on your farm. But if you do have valuable birds that you're hatching out that you want protected, then you would buy Merrick's vaccine. And the nice thing about Merrick's vaccine, there's actually two types of vaccine. There's vaccine that is produced against the Merrick's virus itself. And then there's also a vaccine, which is the turkey's herpes virus, which provides protection, but is not the Merrick's disease.
That would be a better vaccine.
Yeah, that would be my first choice if I was doing my own is try to get a hold of the turkey herpes virus vaccine.
Okay, we have a question about the sand type for dust baths.
I would use the sand I would use is I would use play sand that you would use in a sandbox.
Okay, that was the one
Because
of
there's
the
construction sand and there are all kinds of different impurities. I would probably go with play sand.
okay. Is it all right if some hens do not roost at night?
That's fine. I mean, all that roosting does is give, there's another natural behavior they like to see. They like to do is to roost. It gets them up off the floor. So it gives, if it's wet outside, it gives a chance for their feet to dry, gets them in a natural position. It's kind of like in the wild, they'd be roosting in trees to get away from predators. Maybe they're thinking they're getting away from predators. But if they don't want to do it, that's fine too.
I would wonder why they didn't want to do it more than
They could be too heavy, or they could be, it could be also a social interaction. You gotta remember, chickens are not nice animals all the time, so they may be pushing somebody off the roost.
Yeah, this is true. Put the Facebook page in. Okay. We got a coat of feathers all over the top of the litter each day. Is that normal?
They're probably molting. At this time of year, they're probably gone into a molt because we went through shorter days and now we're going back into longer days. So they're preparing, you probably have a decrease in egg production as well at this time.
I would think so, yeah.
Yeah.
Should you worm periodically or just if you see symptoms?
I would only worm if I had seen symptoms, because what we have found when we have done this looking specifically for worms, if you test the manure at a facility, you'll get eggs and get the idea that they have a large infection, but it's only individual birds.
Yes, we had some birds with lots and some with absolutely nothing. When they have a bird they want to send to the diagnostic lab, which UK does have a diagnostic lab, it's usually dead, right? Not live. They don't want live birds.
Right. And it has to be submitted by a veterinarian.
Yeah. The veterinarian doesn't always have to be smart, but
so
they don't have to do anything except sign their name to the paper and submit the bird. Or they don't even have to submit the bird. They just need to sign their name to the paper and you can bring the bird in.
So what about county agents, Tony? Do they need to do the vet too?
Yes. Yes.
Okay. All right.
The only time you don't, and they also, there is a charge. They pay, there is a charge and it's a substantial charge. So they're going to ask for the responsible party for the charge as well.
It used to be $25 and we sent
about 70 now, I think.
Is it? That was a long time ago. That's why I was asking.
it also depends on what tests they do, because there's the initial taking in of the bird, and then if they have to do, you know, a test for Merrick's or whatever, then there's extra charges for each test.
I'll tap a vet and have them on standby if I need them.
Yeah. Okay. If you just have evidence of start of watery stool, should the chickens be tested, or do you just automatically treat for one problem for the process of elimination to find the problem?
If you had watery stools and it's widespread, or are you talking about one or two individuals?
It just said evidence of start of watery stool, just one or two individuals.
I wouldn't worry about it too much at that point. If you start seeing a lot of it, where it's noticeable that the litter is being wet, I probably would think about trying to treat with something broad spectrum.
I would also look out to make sure that they don't have too much salt,
Yes,
because salt will do that too.
salt will
Especially
do that. Will definitely do that.
if it's in your water, or
And
if
the other
something
thing
happened
too,
to your feed.
if you're feeding a lot of vegetables, that will do it as well. Anything
Just,
that's indigestible can cause that. They're no different than we are.
yeah. Okay, so we went well over. Oh, we got another question. I got a soft shell egg this week. However, I have several other eggs showing signs of excess calcium, small nodules outside the shell. That was 3 to 4 days ago. All eggs seem good now. I feed Purina Laina and was offering oyster shell. Took away the oyster shell after excess nodules showed up. All eggs have been normal for 3 days. They also free range.
Remember that soft shell eggs can occur normally. If when the bird lays an egg, if she goes to lay the egg when it's dark out, she will retain that egg over into the next day. A lot of times, or maybe once in a while, that hen will ovulate another egg coming down the oviduct. So she'll have a well-formed egg and she'll have a partially formed egg, and then she'll lay the egg in the morning, and that soft shell egg will follow the well-formed egg. So just because you got a soft-shelled egg doesn't mean it's a sign of a disease or a nutritional deficiency. They occur at times. Usually they occur at the end of a clutch, where it's a group of eggs all at the same time.
Is apple cider vinegar good for chickens to add to the water?
It's not it won't do any harm, and it could change the pH a little bit and might change the gut flora.
It's not necessarily something you want to do unless you need to clean out your pipes, I would think. Okay, so I'm not seeing any more questions. I put in my email there at the, I'll do it again, but if you have any questions, feel free to contact me. If you have a topic that you would like to see that we didn't include, we have the one in 2 weeks is on manure management and dead bird disposal. And then we will be starting one for people who are into small scale commercial production. So it will be for not necessarily backyard flocks, but for people who want to expand production and make a business out of it. But if you have a backyard flock and you didn't see what you wanted covered in the first 2 webinars, or today's webinar, or the one in 2 weeks, let me know, and we'll put together another series of webinars that will deal with your topics. So feel free to email me with anything, any questions or anything you need. So thank you very much for coming. We truly appreciate your time.